people signed in this morning. The recording has started. I wish you a happy fall day and buenos dias. We have a pretty packed agenda today. Some people had to be rescheduled till next time. So there will be some schedule changes today. But I'd like to run through quickly the agenda so everyone knows generally what we'll be doing today. We'll call the order at 9 o'clock. 9:05, we'll review the minutes. And then we have that presentation that we've been waiting for, which is also going to reset our commission about equity and equality. So Francesca will be here to have that conversation. Then around 9:40, we'll have a conversation regarding new members. SAMHSA, Charlie Smith, will be present to present. We'll take our break around 11. We'll come back around 11:10 and we'll go into the community section of getting updates on prevention, treatment, and recovery. What's going on? Tell us something new. Tell us something that's going on in your organization, something important to share. That's what that section is. 9:40 OBH and the Behavioral Health Administration update. And I hope to get us done on time today. Okay, so good morning. And we always like to start off with introductions. So I'm going to go ahead and lead that off. I'm Bob Dorsheimer, co-chair of Bhpac, and I am on the treatment committee. I'm a member of the MSO, excuse me, and I'm a treatment provider with Mile High Behavioral Healthcare. And Donna, I guess you can call everyone out the way you normally do so eloquently.
If I could get my computer to unmute. All right, let's go ahead and start with Lloyd.
Good morning, everyone. My name is Lloyd Moore. I am a person in long-term recovery. I am the membership co-chair. I'm also on the steering and recovery committee. Also with Last House on the Block. And it's good to see everybody this morning.
All right, how about Michelle? What do you do, Michelle?
Hello, I'm Michelle Hoy. I'm the Executive Vice President at Mind Springs Health, which is a community mental health center on the Western Slope. And we provide mental health and substance use disorder work. And we have the only psychiatric hospital in between Denver and Salt Lake City. And I'm a new member and will be excited to learn a lot more from you all.
Wonderful. And how about Brian Lane? See, it's not just me not being able to unmute, Brian.
Hey everybody, Brian Laney. I'm with Step 7 Ministries in Parker, Colorado, on the membership committee and the recovery committee as well.
Thank you. And Lorraine?
You all can hear me, can't you?
Yep.
I'm Laureen Gilroy. I'm with the Clubhouse Colorado Coalition and Frontier House in Greeley. I'm a person in long-term recovery, alcoholic, and mental illness.
Great. And how about Jacob?
Morning, everyone. My name is Jacob Marion. I am the co-chair, also sit on the recovery committee, and I work as the outreach director for STEP Denver and the certification manager for Colorado Providers Association.
Thank you, Jacob. And Mary?
I got on a little late. Can you repeat what we're doing?
We're doing this introducing ourselves and letting people know what you're here for.
Okay. My name is Mary Maldonado, and I recovering alcoholic, and I have mental illness.
Thank you. Welcome. And
Thank you.
Darren.
My name is Eric Gronemeyer. I work as a peer support professional with Southeast Health Group and also as a team lead and peer supervisor. I'm a person in long-term recovery, and yeah, I think that's about it.
Okay. And we have another Michelle Cotas. How do you say that?
Yeah, Kotwas. It's a tricky one. I'm Michelle Kotwas. I'm one of the social workers on the inpatient addiction medicine team at UC Health, and I'm very excited to be a new member here and see what's going on in the state.
Great, thank you. Crystal.
Good morning, Crystal Allis with Sobriety House. Nice to see a fellow social worker in the room. We provide 2 levels of residential treatment for substance use disorder, as well as IOP and outpatient, and I am on the treatment committee.
Okay. And Darren Valdez.
Hi, my name is Darren Valdez. Hi, Crystal. I'm the executive director of a new recovery community organization called Colorado Artists in Recovery. We host music, art, and meditation workshops for free for people recovering from substance misuse and mental health. I'm a person in long-term recovery and a new member, so glad to be here. Thank you for the invite.
Thank you. And Lorraine.
Hi, everyone. I'm Lorraine Hall, and I'm a person in long-term recovery. I've been to some of those artists in recovery events in the past, and I'm on the board for Life Ring Secular Recovery, which is virtual peer support primarily. We're starting in-person meetings right now. Again, thanks.
Thank you. James.
Morning, everybody. James Gannon, person in active and sustained recovery. I'm the program director at Advocates for Recovery Colorado, and I'm on the recovery committee.
Thank you, James. Lori, welcome back.
Hi, Don. How are you?
Good.
So my name is Lori Banks, and I'm the Chief Administrative Officer for Aurora Mental Health Center, where we provide substance use disorder treatment and mental health. I, like many, are a new member, so I'm glad I'm not the only one. And thank you for the opportunity.
Thank you. Devin.
Hi, good morning. My name is Devin, and I am the Public Policy Fellow with SAMHSA's Regional Office here in Denver. And I'm a new member, I suppose, and here to learn from you all.
Welcome. Aaliyah?
Hi, everybody. Aaliyah Andrews. I'm your recovery TA from OBH.
Thank you. And Jacob.
Good morning, everybody. Jacob Fry with Sobriety House.
Thank you. Stephanie Johnson.
I'm Stephanie. I'm the Director of Community Relations and Public Policy at Mental Health Center of Denver. So the Community Mental Health Center, Denver County. And I'm also a new member. Thanks.
Welcome. Marcella.
Good morning, everybody. First, I want to say that we're having a heck of a time with our internet here at our shopping center where our office is located. So anyway, anything can happen this morning. My name is Marcella Pies. I'm the owner and director of Idea Forum Incorporated. I am a family member and I work on the treatment committee. And unlike everybody else, I'm the old one in many ways.
All right, Angie.
Hi, I'm Angie Wold. I'm the Director of Operations for Addiction Research and Treatment Services, also known as ARTS, and I am also in the treatment committee.
Thank you. And Shannon Miller.
Hi, I'm Shannon Miller. I'm the director at Crossroads Training Points. I'm the director over non-clinical recovery support services. I'm as well a peer for mental health and familial substance use. And then I supervise a team of peers that covers the several counties, 16 counties in Southern Colorado. And I'm a new member as well.
Thank you. Bonnie Holiday.
Yes, good morning. So nice to see so many faces today, and for new folks, welcome. My name is Bonnie Holiday. I'm on the prevention team at OBH. I'm your prevention TA. And as Aaliyah mentioned, she's your recovery TA. So we both oversee programs through the Office of Behavioral Health, and we're here to provide technical assistance, subject matter expertise, to listen. And then also I get some of my best ideas from this meeting. So thank you for that.
Gloria McDaniel.
Hi, good morning. My name is Gloria McDaniel. I am the current president for the Colorado Association of Addiction Professionals. I am also the founder and executive director for a new nonprofit called Cristalida, where we work with victims of domestic violence, substance use disorder, and mental illness. And I am also in long-term recovery.
Thank you. Charles Smith.
Good morning, everybody. It's wonderful to be with all of you, and some of you I know well and some of you I don't know. So glad to be here. Charlie Smith, I'm the Regional Administrator for the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration. Yes, that's a mouthful. And I actually, thank you, Bob. I think that you're giving me a couple minutes on the floor later today. So glad to be with you guys.
Thank you. And Natalie Brown.
Good morning, all. Nat Brown. I am a program manager with Summit Stone Health Partners out of Larimer County. I am advocating for our community-based recovery support programs. That includes Spirit Crossing Clubhouse, supported employment, and the peer specialist program. So welcome to all the new members. Thank you.
Thank you, Natalie. And let's go with Ryan Templeton.
Sorry, the dog here. Brian Templeton, I represent the Office of Behavioral Health and also serve as liaison between OBH and Bhpac. So welcome everyone and familiar faces, the new members. Yeah, it's good to see everyone.
Wonderful. And let's go ahead and do Laura Dykes since while she's drinking.
It's all right. There's a barking war going on in my backyard. So it's very disturbing. Laura Dykes with Colorado Coalition for the Homeless, the Behavioral Health Quality Assurance Director there and on the treatment committee.
Thank you. And Margie Grimsley.
Hi, everyone. I'm Margie Grimsley with the Colorado Federation of Families for Children's Mental Health. And I think Charlie has the longer name, so it's nice to I always feel like I do, so I'm going to give it to you this time. But we are a family-run organization for families with children that have mental health and behavioral health challenges. And I'm on also a family member, and I'm on the membership and the prevention committee.
Thank you. Nancy King.
Good morning, everybody. I'm Nancy King, Development Director for Southeast Health Group in La Junta and Lamar. I am a person in mental health recovery and a family member, and I'm on the treatment committee. And I want to shout out to my friend Eric, who's joining the board today.
Wonderful. And let's go ahead and do Rachel Horde.
Good morning, everybody. I'm Rachel Horde. I'm the Behavioral Health Supported Employment Trainer Coordinator with DVR, Division of Vocational Rehab, and I am on the Recovery Committee. Good morning. Good to see everyone.
And Angie Bertrand.
Good morning, all. I'm Angie Bertrand. I'm the Executive Director of Peer 180, Recovery Community Organization over in Grand Junction, Colorado. And I'm interested in the Recovery Committee.
Thank you. Francesca Galarraga.
Good morning, everyone. My name is Francesca Galarraga, and I am the new Equity, Diversity, and Inclusion Director for CDHS. Happy to join you today. Looking forward to our conversation.
Thank you. Is there anybody I missed? Aaliyah, it looks like you have your hand up, or are you just waving?
No, that was a clap for Francesca.
Okay. Thank you. All right, and I am Donda Gorton. I'm with Office of Behavioral Health, and I'm kind of your administrator for this. So whatever you guys need, feel free to reach out to me. But now I'm going to turn it back over to Bob and let him go.
All right, thank you so much. This is really exciting to see all these
new members today, all this enthusiasm. So next we're going to approve the minutes, and then I'm going to set the stage as to how important Francesca is to the work that we're going to be doing this year. So let's take a look at the minutes. Please review them, and please let us know if you see changes, additions, or compliments on how well they're written and organized. Positive feedback is always welcomed.
Yeah, they were really well written, but on the, I think, I can't remember what section it is. It says name called meeting to order. I think we probably forgot to put the name in, whoever it was. Other than that, they were perfect. I move to approve.
This is Brian Laney. I'll second that motion pending the change.
Thank you, Brian. Is there any further discussion or concerns before I approve the minutes? Minutes are approved at 9:18. Thank you, everybody. So what we talked about pretty much during the pandemic, we've watched the world change before our eyes. We've watched the George Floyd horrible situation. We've watched Elijah in Aurora. We've watched many things that have taken place during this pandemic that were related to mental health, substance misuse, recovery concerns, criminality, and most importantly, lack of equity, diversion, and inclusion. Since this group comes together and talks about making recommendations to the Office of Behavioral Health about the block grant funding, monies, recommendations on underserved populations, I really felt it was time for us to understand what it means to be an underserved population, what it means to access the block grant fund, who are these people, how do they access it, how long can they access it for? And when we're making recommendations and we're looking at providing feedback back to the Office of OBH, is it done through an equitable way? Is it done with equality and justice in mind when we're looking through the needs of Coloradans? So as a departing member of this commission, that was one of the things I wanted to instill into this commission, was this work and making sure that all of our recommendations and everything that we do goes through the lens of equality and equity. There was a period of time that everybody that's in recovery in this room did not have a seat at the table, nor did that service providing program and structure in Colorado, nor was that even funded. And we went through all of these equity and inclusion conversations, kicking and screaming, trying to be inclusive. So I want us to learn from history on what processes have been like, and to make sure when we're talking about underserved, marginalized communities and people that don't have access, I'd like us all to at least have the same footing on what does that mean? What are these big words that people are using nowadays? And how does it apply to our work, our bylaws, and our decision-making process? So when we brought this up, Ryan so eloquently said, I know this director that we now have at the Office of OBH that can provide this help towards us. So Francesca, welcome. And that is the prelude to the work we hope to be inviting you back to all year as we transform our BPAC council together. So welcome. And I turn it over to you, and we're very excited to have you today.
Thank you so much for that introduction, Bob, and for setting the stage. I think it's important that you mentioned everything that happened over the past year. I've been calling 2020 the year of the next cultural evolution, right, of the civil rights movement, because we really did have an opportunity to stand back and watch all of the things that sort of have been happening in the world without us having to address them because they were silent, they were hidden, they weren't happening in front of all of us. But I think what happened last year really gave us an opportunity to think again about how we do work around equity, diversity, and inclusion. And it's given me a newfound passion and commitment to the work. And so just to tell you a little bit about myself first, I've been doing diversity, equity, and inclusion work for about 20 years. I started doing the work with the Walt Disney Company. And when I was with the Walt Disney Company, they taught me the foundation for all of this work that I've carried with me for, like I said, 20 years. And that's at the foundation of everything that we do. When we use the big words, and I'm really glad that you talked about terminology, Bob, because terminology is key for us to be able to do this work. What the work is really fundamentally about is about creating a place where people feel respected, appreciated, and valued, right? If we can do that, we are doing everything else, right? Because in order for us to have equitable practices, we need to make sure we have all of our community voices, everyone that's being affected by policies and procedures at the table, you know. And when we look at and think about the different demographics that we serve, we have to serve the underrepresented populations. They also have to be at the table. And then in order for us to be more inclusive, all of those voices not only need to be at the table, but they need to be heard. So we need to be listening and taking action around that. And what we are doing at CDHS is all of that. So last year we developed a series of equity action plans, and those equity action plans had 5 major areas. It was around doing work around leadership, doing work around employee and community engagement, looking at our policies and programs, making sure that we are assessing them with an equity lens, learning and growth for internal and external audiences, communication, and then we wanted to focus on our employee life cycle, because if we don't have healthy, well-adjusted, employees who have the bandwidth, both mentally and physically, to be able to serve our communities, we can't properly serve our communities. We have to take care of those who are taking care of people in our communities. So it was really important for us to look at those 6 areas and to have internal and external goals. So internally, what are we doing? And externally, what are we doing for the communities? In each one of those sections, we have a series of goals that we are committed to doing through 2025. The areas that I think will affect this particular group the most are the employee and community engagement aspect, and then the policy and program assessments. And for those, we really are looking at making sure that we're decreasing barriers for community members to engage with staff, to make sure that they are part of the policy process, and making sure that we're having community voices at all of our tables, making sure that we're reviewing our policies and our practices in a way that's meaningful. And we've created and are in the process of creating checklists for how to review those policies and practices so that they are much more inclusive and much more equitable. The other thing we're working on is a lot of internal work, and that's level setting. And what I mean by that is when we hear the words diversity, equity, inclusion, and all of the things that come with them, everybody has a different definition. In fact, if I were to ask each of you, what do those words mean? I would get at least, there's 33 of us, I would get at least 30 different answers. And so it's really important for us to make sure that we're all speaking the same language. And so our goal is to start with defining what does that mean for us? What does that mean for the state? And working with our state partners to make sure that we are all looking at it in a fair and equitable manner. We have what is called an Equity Alliance, and I don't know if any of you have heard of it, but it's a series of people like me, diversity directors from all of the different agencies that are collaborating so that we can start having a set of guidelines for us across all of the state agencies. So if any of you work with multiple state agencies, you know that our policies and our procedures and sometimes our rules are different. And so one of the things we're doing is all of us being really introspective and making sure that we're working across agencies for this work so that we can make it more consistent for our community members and for our partners. I'm going to stop right there and see if anyone has any questions, and then we can continue the conversation. I would love to hear your thoughts.
So Francesca, this is a year that I spoke to, and this is a community council, by the way. 51% has to be made up of community members that represent the services that are offered through OBH. Yep. So when I took a look at, and this is my 6th year, and now I'm on a 7th pandemic emergency leadership role position right now. But what I really felt was important to leave the commission with was the feedback that through the years, as an openly gay executive director of an organization, I had to bust my ass to get a seat at the table for a number of years and to be heard and to be valued. So the work that we do in this group, I've often seen people drop in and drop out of our council. And I know it's because how people feel value or if they feel how their experience is heard. So what we're doing this year is resetting that, everything you just said. We want to take a look at policies. I think it's really important to have a defined group of definitions. Like you said, my definition of inclusion and equality comes through the lens of a 54-year-old gay male. So therefore, that's my experience I bring to the table, and those are my values. It doesn't make them right, it doesn't make them wrong. It's just the lens I've lived through. But if you can help us come with, commonalities and then come back several times, I'd really like this council to be something to be really reset over the next 12 months and to be really state of the art in a place that the state and community can come bring any problem when it comes to behavioral health, because we have 51% of lived experience and treatment providers and all these amazing people around this table. We can do some great work. My concern is we just don't have commonality and understanding of what all of these definitions mean. And we need to come to consensus. We need to take a look at our policies. We need to take a look at our communication. So everything you just said is remarkable to me, because that's the work we want to do this year. The other thing I'm going to be doing is suspending the way we do our group work this year, because we do group work and we go off into silos. I'd like us to do all of our group work for a period of time together. And then once we all have the same knowledge of what the groups are doing, the commonality and the understanding of those groups, then we can go back and do some of the work individually. But right now I'm keeping us all together, and we're all going to learn together instead of always breaking up and going off. I think this year is about connectiveness, understanding one another, understanding the block grant, understanding the word underserved. What do these people look like? How do they get access to these underserved dollars? All of those kind of things. So you are key, and any technical assistance you can provide us. Just know that this is the work this council is doing for the next 12 months.
Thank you, Bob. I would love to come back. One of the things we're doing is making sure that everybody understands their role in the work. So would love to come back and spend more time with you all to have that conversation. Marcella, I'm sorry, I think you were going to say something.
Oh, that's okay. I do believe that maybe this is the first time I've seen it together, diversity, inclusion, and equity, but they're really old words. And so not new. Maybe the three combined in the same sentence, perhaps. And it did. I just want to make a slight correction. This didn't just happen in 2020. In my lifetime, I've been seeing it for many, many years. I was hired to do diversity at Coors Brewing Company. If any of you know the history of that. And if you're curious, I'll show you the scars on my back from that experience. However, it was a wonderful experience and I learned a great deal. That was in the 80s. So I've never lost hope. I've never lost hope. And so while I say that these words are not new, the work is not new, I've never lost hope. And so I always want to be a part of solutions if I've got any complaints, and I do have a ton of complaints, but I welcome another effort, another stand. I love the idea of including the three. I invite you to come and see the staff at IDEA because of the percentages of the folks that are represented on our staff. We strongly represent the people that we serve in all aspects. And so I would really like to take a look at your work and the documents you've created, the goals, because if that can improve and get us even better from where we're at right now, I welcome it. And I really look forward to working with you. I love working with Bob and this group. I'm always excited to see Charlie Smith. I keep trying to figure out which one of us is going to say goodbye first. We've had a competition going for years. I'm so glad to see him well in here, but I openly embrace the work we're about to start. Thank you so much for coming and Bob for making this a huge focus for us.
You know, Marcella, I said that I've been doing this work for 20 years and I've seen even for me, the words have evolved, right? And I used to say, when I started doing the work, my job is to eliminate the position. We should never need diversity practitioners. And I would say by 2020, which I think is really funny, by 2020, we won't need people like me anymore. And well, here I am.
Just to note, Francisca, actually from Coors, I was sent to Disney for training. Yeah.
We were fortunate enough, and I didn't know it at the time when we started doing the work, that we were being taught by people who are called the mothers and fathers of diversity at work. And so we learned from the people who were at the time creating the work that we're now talking about, you know, historically, but a lot has changed. So thank you, Marcella. And I did write down ideas. So I would love to talk more to you.
Oh, please. Yes. Thank you.
Other comments?
Excuse me.
So seeing no other comments, the first thing that I will say is where I have been starting with some other groups. And like I said, I've been here now 4 months. So just finding my office in downtown Denver was the first month. One of the things I have been doing is just, like I said, level setting. So I would love to come back and just have a conversation about how this work affects all of us. And I think, you know, we talk about it in terms of understanding our own diversity, right? Because we all are unique and complex individuals. And when we talk about our own diversity, it gives us more breath, if you will, to think about all of the different groups that we belong to, where we have different levels of dominant and subordinate relationships. And we don't always recognize when we are in a dominant position and when we are in a subordinate position. And so we talk about it in those terms, get those definitions. What does it mean to be, what does diversity mean? What does inclusion mean? What does it mean to be equitable? And then once we have that, a sense where we can all agree to the ways that we're using those terms, because there's no real one right way to define those terms. There's an agreed shared term that we move forward with. And once we agree to those terms, you all can then, you know, feel free to have those more complex conversations, but it's really important for us to just start with foundations. And I would love to come back and do that and spend more time with you.
Francesca?
Yes.
I think that we will, it will be as easy as possible for the council and OBH to come together on definitions of terms. But are you or the state doing anything with a bridge between the state terms and the communities that are being served? Because I'm kind of hip. I don't know the half of what is being talked about. I probably could explain it if I used a different word, let's say. Or if somebody were to give me an example. Oh, I know what you're saying now. So I'm wondering if in the work that we do, will we have some support or a resource in the state with how to communicate to and from the communities that we're serving with these terminologies and these ideas of how we're going to issue a block grant. If we're going to meet with the Chamber of Commerce or somebody else like that in a small town, are they just going to say, what the heck? You know, the Denver people are coming. No, we want to be able to communicate.
So the state, there's two things happening at the state level. The Department of Personnel Administration will be forming an Office of Equity, and that should start sometime next year because we were given an executive order by the governor in August. So my position exists and it's as old as I am. So I'm the first person to be the CDHS EDI director because of this executive order that was passed by Governor Polis, right? And because the employees at CDHS said that they needed a position to value and to focus on this work. What has been done at the state level is there is an equity alliance and an equity, diversity, and inclusion cabinet. The cabinet is comprised of all of the agency directors and their equity, diversity, and inclusion director. So we all meet every other month to talk about what we're doing across the state. And so we are also developing a shared vocabulary for everyone and all of the different agencies to share. Okay. So we're hoping to be consistent in that way.
Would it be possible for you to come back next month for about 20 to 25 minutes and talk to us about those 3 words and how far you've gotten in definition so we can start hearing and if you have any written work that you can send to us early so the council can review it. I'd like the council to start getting used to seeing the words, the definitions, so we can kind of work with the state's guidance and definitions and adapt them to us and our council work, since we are community-based, and how to build that framework with the guidance that you're coming together at the state. So, but I think equity, inclusion, and equality, I think we need to start, at course level 101 is really where we're at. And then by the end of the year, I hope to have the last quarter of this year, us spending time with our bylaws. And actually, because we're so smart, we're able to go through our bylaws and take a look at the inequalities and equities and how we make our recommendations back to the state over financial means to help underserved populations, that we will have a new lens. So my goal is to start at 101, build a new lens, and then the commission can start off fresh and go forth. So this year is a real reset. So is that possible?
Yep, absolutely. And one of the things we're working on is a checklist to help organizations and different groups as they're going through and looking at their bylaws or looking at policies or looking at rules. And it's a checklist that sort of has a series of questions. So,
Great.
when we made the bylaws, who was at the table, who's not at the table, who's being, advantaged or disadvantaged by how it's written, or so I'm hoping to have that completed next month too, that I would be able to share with you, but I would love to do that.
Great. So if you can come back next month and touch base and just start some of the definition work with us. I would love to have you monthly for 20 minutes a month if you have that time to keep us moving. We do have a break in the summer. So it's 11 months that we meet, but this is our goal this year. This is it. So as much advice and technical assistance, we're happy to do the work when you're busy. We just need the support from your office, and I'm very excited to have you. And I think the governor made the right choice. I am familiar with Walt Disney's program as it being a gold standard for employers. So my last question to you is, all of us that are licensed through OBH, do we have access to you when we're taking a look at our policies and procedures for the department as a licensed organization?
That's a great question. I don't have an answer to that. Ryan, it looks like he does though. Ryan looks like.
Yeah, Francesca, thanks for coming today. The one other piece that I want to add is that the Office of Behavioral Health is in the final process of hiring a community engagement position within OBH. So Francesca is with CDHS, so she really has that oversight of all the offices underneath CDHS, as well as she had mentioned that there's similar positions to her in other state departments, which she meets with on that larger level. So we will have a specific position within OBH that will be very, very much involved with BPAC every single month, coming to the membership meetings, coming to the steering committee meetings, and eventually taking over my role on BPAC and being that community engagement person, and essentially working closely with Francesca, more closely than I do, kind of consistently meeting with Francesca to ensure that community engagement is meeting the lens and the scope of everything that's happening within the larger frame of the EDI work happening in the state. So with that, I think there's everything's moving in that direction. It's very new, but I mean, I think that's exactly, I think BPAC is right there kind of on that cutting edge of really implementing EDI work within everything we do and really focusing on every aspect of BPAC that needs a refresh, or at least a look at how things are operated. So with that, I mean, I think we can make that commitment from the Office of Behavioral Health to ensure that those positions, and Francesca also mentioned the action plans. OBH has a specific one as well, so we can bring our specific action plan to the council, which I think is more of the BPAC OBH relationship than Francesca has. I mean, obviously Francesca is very involved in that process, but I think there's that next level that a little bit more interaction will take place from there.
So Francesca, given you're in a new position and you're very busy, this is the time that we meet once a month from 9 to 12. Also, I would ask if you can get on our calendar for whatever works on your calendar. We will adjust our agenda as it sees fit to accommodate your busy schedule, since this is our work this year. And until the other person that Ryan speaks of is seated, I'd like to keep the momentum going before that transition happens. So you're welcome to dive in and spend 20 minutes whenever you have time. We will suspend our agenda and get you welcomed in during any of that time, since we believe this work is so important this year.
Thank you, Bob. We also are hiring a program manager to assist with some of this work. So there'll be a couple of us that will be able to assist. We've had Marjorie and Bonnie have had their hands up for a while, so I want to acknowledge them.
This is Margie Grimsley, and I just, I wondered if the work that you do also takes into account in regards to diversity, inclusion, and being equitable in a council. And I think our council is a real example of bringing together when the joint when we merged and became the behavioral health. So it brought in the mental health and the substance use to as one council for the block grants, the two different block grants. Does your work also include, how do you help ensure that a body, a council is also doing those three things to ensure that everyone at the table feels that their voice and their perspective is heard? Because I really think that, you know, I know from my world, it's the child and family world. We have consumers, we have providers, we have state agencies. So many different perspectives sit at this table. And it, at least from my perspective, I think it can sometimes be challenging to feel that each one is heard. And whether it's equally, but at least being heard, and it is an environment where they can share. Is that a part of what your process is? Because this certainly isn't unique to just this council. Other entities try to merge and bring different groups and different perspectives and different worlds together. Is that a part of what this is included, or is that kind of in a separate process?
At a high level, it is part of the process, right? It's making sure that we have the right voices at the table, right? Those that are being affected, and that those voices have an opportunity to share their perspectives, right? And ultimately that we're doing it in a way that feels respectful, that feels like their voice is actually being heard, right? Because it's one thing to be given a seat at the table, it's another thing to have the opportunity to share what you're thinking, what you're feeling, and how it's this, you know, whatever it is we're working on is ultimately going to affect you, and to make sure that those policies and practices then are modified or before they're created. We always hope it's before they're created, right? Can really take into consideration everything that's being said. So a lot of the work has to do with all of you, right? And making sure that you know who's at the table, who's not at the table, and making sure that those voices are included. But
I guess I just also, I think when the state is creating these things and merging things, that has to be a component of knowing that you just can't say we're going to merge these different worlds together and then walk away and say we've done a good job of doing that. It's really that part of how is that transition, and how are you ensuring that you're helping people be able to better work and become a team rather than, I don't want to say adversarial, but at least it's how do we build trust between those different worlds versus not. And I'm sorry, I'm probably not saying this well, but it's an important piece, at least from what I've observed over the years.
a great deal of this work is trust building, is how do you create an environment where people feel like their voice is actually being heard. And that's through, you know, building community and building trust. So I think you've sort of hit the head or nail, or I don't know the expression, but we really do need to make sure that we're focused on how do we create a trusting relationship. Right? Bonnie?
Awesome. Thank you so much, Francesca, and thank you for joining us today. I'm on OBH. I'm also on the OBH EDI matrix. And actually, something that Laureen said made me think of something that our prevention team is doing. So we fund a lot of rural communities. And yeah, sometimes there is that sense, oh, here's, you know, the program manager from Denver, you know, who doesn't know what life is like here in Baca County, coming to tell us how to do things. And so one of our deliverables for our grantees is and it's produced by SAMHSA, it's the Culturally and Linguistically Appropriate Services Checklist, and it's meant for organizations. And so when we unrolled this, I knew some of our grantees would really be excited to do it. I was a little bit nervous about others. I met with Campo School District in Baca County, where they have 54 youth ages K through 12 in the whole district. And I was like, okay, so what are your first thoughts when you look at this deliverable? And they're like, well, we all speak the same language here. You know, there's no linguistic diversity. And it's like, okay, that's okay. And then, you know, we just started having a conversation about who might not always be included in like youth activities and things like that. So I'm cautiously optimistic that our folks will have a good time with the deliverable. And I'm wondering if this group would like for me to kind of bring back reactions and everything, so we kind of have an insight into that rural perspective with this work.
I definitely would, Bonnie. I think that's a great idea.
Yeah, I appreciate the lens that there are different cultures across the state in terms of rural, urban, frontier. Every city and county we serve is very, very different than the next. And I think those are important. Yeah.
And Bonnie, I would also just say, linguistically, we may all speak the same language, but we don't speak it the same, right? So when we use idioms, like me trying to get, is it hitting the nail on the whatever it is, that expression, all of those different expressions are barriers to communication, right? Or potential barriers to communication, because we might be using expressions that we don't know. And so it's a way of level setting that too, right? It's like, we want to make sure that, yes, we all speak English, but we may be speaking it a little bit differently, right? We use words have meanings, and for some of us, they mean something else, right? So that's an important aspect of it too, but I love that. I actually am going to touch base with you to see if I can get that.
Well, we have time for one more question. Sorry to be the taskmaster. So if there's one more question, we hope to have Francesca and staff back monthly, as this is our #1 goal. So please speak up if you have one more question. If not, we need to thank profusely Francesca for the work and coming to our state and helping us and staff, because Colorado needs it, that's for sure. And I'm excited for the transformational work this council's about to do. Any other questions before I move us on the agenda? Francesca, thank you so much. We hope to see you back next month. Let me know if you want to crash executive committee to be prepared. Ryan can work with you, or however you want to, Ryan, when a liaison. But we look forward to starting our 101.
Thank you so much, everyone. Have a great meeting.
Ciao.
Bye.
Thank you, everyone. Great questions. Next is membership committee and all of the new member introductions. So take it away. Let's get to meet all of our new peeps.
All right, my name's Lloyd. First of all, the current membership got a list sent out of why we felt each of our new members would be valued to the council. We do have a person on that list who is not joining us today and may join us in a future month, and that is Sophie Lillyblad. So for our existing members, we will not be going through her. So let's start with the people with personal experience. So these are people in meeting our SAMHSA council requirements. These are people who are a consumer or client of either mental health or substance abuse services, or are a family member or an advocate of the community. So if you could do a little bit of a little bit more of, as I go through these, maybe a little bit more of an introduction of who you are, and we would appreciate that. So first, let's go with Darren.
Right off the bat, thank you so much, everybody. I'm so glad to be here. I'm a person in long-term recovery. I started out at the sobriety house. There's a lot of sobriety house people here. And while I was there as a house manager, I was doing counseling and training, but I had a bunch of people come through the program that couldn't seem to find their community when they were leaving treatment. And a lot of them were really artistically gifted and within music or art. And I just had an idea, and some friends helped me develop it, to create some workshops outside of treatment. So when they leave treatment, they have a little bit of a community when they get out. And these are free programs they get to join. We do 6-week sessions of art. I get they're peer led. So they're people in recovery lead these art workshops and music workshops. And it gives them a community of people. We have them reach out to each other during the classes so they get to meet new people. We've been able to do 12 workshops this year. It's our first year of doing this. We started out doing online, and then we just recently in September started doing half of them in person. We find community partners that let us use their space, and yeah, it's going really well. It's actually, we've had a wonderful response that people really seem to enjoy the classes. And that's what I bring. It's called Colorado Artists in Recovery. Our goals are the next year. We served over 200 people this year. Our goal is to double that for this next year and to have over 18 workshops. We also have a monthly creative meditation virtual every month for people to join. And anybody, not just people that are struggling with substance misuse, but people affected by it. So family members, people struggling with mental health issues or any kind of recovery, really. We've kind of opened that up a little bit to anybody who needs community during these times. And we use creative expression as a means to bring us all together.
Thank you, Darren. Eric.
Hello again, everybody. Thank you for allowing me to be a part of this council. It's an honor for me. So as I stated before, I'm a person in long-term recovery, both from substance misuse and mental health. And I work as a team lead. I never know exactly what my title is, with Southeast Health Group. We're on the southeastern corner of the state, where we provide peer-run services out of 2 primary locations in La Junta and Rocky Ford. And our program is unique in that we are open to the entire community. Someone that is coming to see us does not necessarily have to be involved with the agency we operate under. Yeah, and so we kind of have been expanding and working towards building out more of that. And I personally have been working towards expanding and elevating the professionalism of peer work in our area. And that's been done through multiple meetings with other agencies and entities across the state. Yeah, I think that's about it, guys. I don't know.
Thank you, Eric. Mary.
Hi, my name is Mary Maldonado. I am on a couple of committees here in Fort Collins, and one of them is the Healthy Lamar Committee and the Behavioral Health Policy Advisory Committee. And what else do we need to say?
Just anything you would like to say briefly about what you believe you're bringing to council.
Well, I believe I'm bringing my lived experience with mental illness. I've been diagnosed since 1988. I was in my early 20s, and I have knowledge in being in recovery, taking medications, understanding how people might feel when they're first diagnosed. And I'm also a recovering alcoholic, so I understand those 2 aspects of when people are struggling in those areas, that I could be understanding and I could give some feedback on what it was like without having somebody to help and somebody to give you resources or even explain what I was diagnosed with bipolar depression, but I wasn't given the signs or the symptoms on what to look for or what the process was that I was going to be going through. I had to research that myself. So being able to give other folks information on whatever. I'm also a volunteer with NAMI. So I have lots of information on the different kinds of mental illnesses, and I have pamphlets to help understand what those illnesses are and what the signs and symptoms are too.
Alrighty, thank you, Mary.
You're welcome.
All right, so then we have various classifications, which we can get into as we get into some items over membership, which we will in the future months. So these are individuals that applied that are a provider of mental health services or substance abuse or integrated care. And so with that, let's start with Gloria.
Glory.
Great.
So I am a licensed addiction counselor, licensed professional counselor. I am a survivor of domestic violence and childhood abuse and in recovery for the last 28 years. I have been leading faith-based 12-week groups for women who have trauma and substance use for the last 8 years as well. Working with the Hispanic Latino population since I am bilingual and can do counseling and group counseling in both English and Spanish. I started my nonprofit last year to at some point provide transitional housing for women who are suffering from domestic violence and abuse.
All right, thank you. Lori.
Hi. Excuse me. I represent Aurora Mental Health Center, but I hope to bring to the council a lot of different perspectives. I was an employee at the Office of Behavioral Health for 20 odd years, which I almost hate to say out loud because it dates me, but 20 odd years I was employed with the Office of Behavioral Health and then moved into providing services in the community and now doing more of an administrative role with Aurora Mental Health Center. I'm a licensed clinical social worker as well, and a person of color. So I feel like I have a lot of different hats and can bring a lot of different perspectives to the council. So I appreciate the opportunity. I'm also excited to be part of the council because we are building a council as well at Aurora Mental Health Center. And I think it's about time that we've done that. And I hope to bring information from this group to that group. So appreciate being here.
Thank you, Lori. How about Michelle Hoy?
Hi, everyone. As I said earlier, I'm the Executive Vice President of Mind Springs Health. We provide mental health substance use services in 10 counties, 23,000 square miles in Colorado. We served about 24,000 individuals last year. So we have urban, rural, and frontier communities, lots of different kinds of diversity, I would say. I really, I think, come to this work. I'm a licensed professional counselor and a certified addiction specialist, and come to the work with lots of passion about helping others and creating good systems to make that happen. I have many family members, as most of us in this field do, with mental health and addiction issues. I have a kinship son who is Native American and Hispanic and has a lot of mental health and addiction issues in his biological family. So this touches me in many, many ways. And I think as treatment providers who work with block grant dollars and all of the things going on, there's that additional piece to bring about how we can make things really work. Not just for individuals, but for providers as well. And much like Lori just said, we are really beginning our journey here at Mind Springs around using the class standards and other things to do better internally at our organization. So I'm excited to take information from this group back to my organization. Thanks.
Thank you, Michelle. How about Michelle Quadis?
Hey there, and it's Katwas. I know it's a tricky one. It was better than my maiden name though. So I work inpatient at UC Health, covering all inpatient areas, and I'm on an addiction medicine consult service, which has been sort of revamped by our medical director over the past 2 years. It's a grant-funded program where we're training hospitalists, so doctors that staff our hospitals, in becoming boarded in addiction medicine. So we are mostly seeing patients who come to the hospital for whatever reason and have expressed some interest in sobriety or recovery. So in meeting with our patients, I'm getting to know, really the needs of the community firsthand from patients telling me, yes, that will work. No, that's not going to work. A big part of our learning process, because I'm new to Colorado in the past 2 years, has been to visit a lot of our community partners. So I see Jacob on there. I know I've met a couple of you guys in the community. But we're also learning about, we had a patient die who wasn't able to access treatment in Spanish. And he was homeless, and the pandemic has really set everything over the edge and highlighted, I think, our treatment gaps in the community. So I'm really happy to bring that perspective. I also come from Baltimore, Maryland, which has a really severe opioid problem. And so trying to bring some of that knowledge and the things we were doing in Baltimore to Colorado, which is, emerging with an opioid problem now. So yeah, I'm really excited to be here. I also have several family members, some not yet in recovery, some who have unfortunately lost their lives due to this battle, but I'm really excited to be here, and I'm really grateful to be a part of this.
Thank you, Michelle. Shannon.
Hi, I'm Shannon Miller. As I said before, I'm the Director of Non-Clinical Recovery Support Services with Crossroads Turning Points in Southern Colorado. That's a new position. We've really tried to work with our outreach into the community and working with multiple different groups to be more inclusive and to try to be more, to provide more equitable services. But for me, I have children with mental health and family members, as well as substance use. And then really critically is I've helped try to develop a peer program there that is networking across the board, because we know that, one of the biggest ways to help people stay in stable recovery is to have social connection. And so really trying to bring recovery oriented programs out, similar to Eric, who I know from Southeast. Our peers and this particular team, we work with everyone in the community. They don't have to be a Crossroads client for us to serve them, to provide one-on-one support, whether that's in person, whether it's virtually through groups, just a variety of things. But we cover about 16 counties. Our little peer team covers about 16 counties. And we have the same thing. We work in rural, urban, and frontier settings with persons of all colors, persons of all economic levels. So it really, mental health and substance use really are not respecters of anyone. They cross the gamut of all people. So that's a little bit about me and what I do.
Thank you, Shannon. And Stephanie.
Hi everyone. So yeah, I'm again from Mental Health Center of Denver, and we're community mental health center. We're one of the ones for Denver County, provide behavioral health services across the lifespan. And I am a licensed clinical social worker and a licensed addictions counselor. I've worked there for 11 and a half years. And 10 of those were in direct, or 10 and a half of those in kind of our direct service from a case manager. I worked in our access department. I was also a program manager for some of our clinical teams. And I'm a big advocate for our direct service providers and the work that they do. In my role right now, a little bit more focused on our community partnerships and our involvement in policy, but all of that for me through a lens really of trying to use that role to help really advocate again for the folks doing the work and the people that we serve.
Thank you, Stephanie. So one of the things the membership committee knew that we needed to work on, and it just kind of happened naturally, was working on the diversity of the council, as so much of our council has been from the metros, the urban or suburban area, and it's great to have members who apply that are also in or provide services for the rural and frontier areas. So the way this process works is that the membership committee brought forth the recommendations of our new members, and the council as a whole needs to vote to recommend these members as well. The actual appointment to council is done by the Director of Behavioral Health, which is in Ryan's realm that he will handle. And so I need to turn this back over to our co-chairs.
So I don't believe we vote or anything. Is that correct? Is that correct?
So this is Ryan. I mean, I think the formal process would be voting to formally recommend these individuals for formal appointment from the director of OBH.
All right. It's been so long. I have pandemic brain. Lloyd, you want to put your motion out, please?
Yes, I would like to make a motion to put forth our recommendations for our new members to the Director of Behavioral Health as council members.
I second.
And Lloyd, just for clarification, it's the full slate that you presented today?
Yes.
All right, so full slate you put forth, and we have a second.
Second.
Is there a discussion?
Laura Dykes, second.
Gotcha. Thank you. Is there discussion? Is there anyone we want to kick off? Kidding, kidding, kidding. Little humor. It's been a long morning. All right. By the show of hands, waving like this, we've got new members. Go. Yay, I see lots of fingers. All right. Anyone abstaining? Is there anyone saying nay? It passes. It goes forth to OBH with council's blessing for the appointments to take place. Motion closed. Congratulations. Thank you for signing up. A very impressive group of people. Very, very, very. Lori Banks has been around a long time. I'm just going to date her myself. So she hired Ryan. So sorry, Lori. It's nice seeing some other people that work out here in Aurora. And Mind Springs, I would love to hear more about the work and the frontier and mountain kind of mental health and substance use that you do. It's pretty incredible work trying to access those communities. And that's part of our equity and equality, is that we need to learn more about all Coloradans and how they access our services. All right, so I'm going to go ahead and give us our break now. Is that okay, Charlie?
Bob,
Sorry,
if I could yeah, can you guys hear me?
Are you crushed on time?
I am crushed on time. My apologies.
No,
but I just,
worry.
yeah, if it's okay, Bob, I'm happy to just kind of crush it for a couple minutes, and then I'm more than happy to come back anytime for more dedicated discussion.
Go right ahead. So, ladies and gentlemen, Dr. Charlie Smith, who I feel all raised up. He's been around a very long time. He is brilliant. He's worked at OBH. He's worked in the community. He's a true passionate person when it comes to recovery, when it comes to treatment, when it comes to evidence-based practices. And most importantly, I have always been valued in the work that I do and the agency that I serve. So Charlie has a true passion when it comes to listening, hearing, validating, and trying to find services. He's a good dude. So Charlie, you're on deck.
Thank you, Bob. And it's really a pleasure to be with all of you. And Bob, you were gracious in your introduction as usual. And I owe you a hug once we get in person. So good morning. I'm going to spend just a little bit of time, but I love to see all the dance hands. So keep it going. If you guys need a break, go ahead and take it. But really happy to be with you today. And again, as I said before, I'm happy to come back anytime. For those of you who may not have heard, yes, I'm Charlie. I serve as the federal lead authority for mental health and substance abuse for Colorado, as well as the other states of Region 8, which include Wyoming, Montana, North and South Dakota, Utah, and Wyoming, and 33 tribal reservations in that territory. I work for SAMHSA. My position officially is the regional administrator. And by the way, with me is Devin Sweat, who is the Region 8 SAMHSA Public Policy Fellow, and it's a fellowship I established. Laura, you're going to choke on this 6.5 years ago. We're really, really pleased. And I know that Devin is thrilled to see so many social workers in the room, in that she is a Metro State social work student. So I just want to spend a couple minutes. I've done this in the past for those of you who may not know. Obviously, when pre-COVID, I would periodically kind of hang out with you guys for your council meetings, and that very much remains an opportunity for us, which we welcome. And we hopefully can offer things with regard to what's happening in the big house, if you will, at SAMHSA headquarters, which serves as a backdrop or a backstop a little bit for council and your existence. And clearly your role and function as an advisor, as a recommender, as a steward for the Office of Behavioral Health as your state mental health authority and single state authority for substance use. Those designations are key. Those designations exist in federal law, and those designations are actually supported by SAMHSA through the mental health block grant. And as a state, you have chosen to extend that to the substance abuse block grant, which I significantly applaud you for. So a couple little things that may be of interest to you, just to kind of give you a sense of what's happening at SAMHSA, that you may choose to weave into your work and your guidance alongside the state, as the state and you are reaching new communities, expanding care, and really building out what it means to be a behavioral health provider to meet the needs of individuals, all individuals with mental health and substance use issues. So first and foremost, SAMHSA, we're very much alive and well. We have an assistant secretary who's a political appointee whose name is Dr. Miriam Delphin-Rittman. Dr. Delphin-Rittman is the former state director for Connecticut. Much like Robert Werthwein serves as your state director here in Colorado, Miriam held that position in Connecticut. Miriam has done I think a very quick job in the last 4 months of establishing her operating priorities. And I think this kind of gives you some structure, at least with regard to how SAMHSA is thinking. One is very much focused on preventing overdose. Clearly, we are seeing a significant ongoing epidemic with regard to overdose, and it's not just opioids. We're seeing it as it relates to stimulants, alcohol, and other substances, but addressing overdose is significant for her. Number two, enhancing our access to suicide prevention and crisis care. If you are not aware as a council and your respective entities and communities and agencies that in July of 2022, so roughly 9 months from now, there will be a new complement to 911 called 988. That will be the national 3-digit lifeline number for anybody in a behavioral health crisis. That structure, that infrastructure is being built principally by SAMHSA, but alongside the Veterans Administration and the FCC, which oversees telecommunications laws and rules, is building out that infrastructure. So in addition to 988 as a 24/7, 365 hotline, warm line, just like 911 serves, it's also building infrastructure within states and local communities to actually then have someone to respond. So mobile crisis services, that may be law enforcement, that may be Colorado's leading edge around co-responder models, whether that's EMS, law enforcement, fire, park rangers, you name it, as well as creating new ways of providing behavioral health providers, behavioral health agencies, including peers as principal responders to individuals in crisis. And then the third component of that crisis system is thinking about a place to go. So really thinking about our infrastructure for acute treatment units, short-term stabilization programs, emergency departments, respite programs, and really thinking about the breadth of a place to go when someone is in need, understanding that individual's needs. The third area Dr. Delphin Rittman is focusing on is establishing and promoting a child, youth, mental health, substance use agenda for the country. This is the first time that SAMHSA and the federal government has actually had a child, youth, behavioral health agenda. And she's leading that edge for the country. Fourth is her ongoing focus, our ongoing focus on integrated team-based healthcare, really moving our needle with regard to a healthcare delivery system where health is health is health, and we maximally merge this understanding of behavioral health care alongside physical health care. And then finally, advancing significantly our use of data. So that data is really earmarking those programs that are working, those programs that are effective, and those programs that have promise that we know that we need greater work and money and resources to actually implement, but really promoting data to drive those new innovations. Now, across those 5 areas, our agency with Dr. Delphin Rittman's leadership is focusing one on equity. So your conversation earlier about equity with Francesca, I think is dynamite. And as a council, one of the things that I've mentioned in other state councils is to think about your council makeup. Is it truly reflective of the diversity of Colorado? And is there a way to make sure that all populations, all communities are represented to inform and guide the state in its execution of behavioral health care? So the council, as one operational kind of goal, can take a look at that without federal expectation or federal law directing you to do that. But we're very much focused across all of our grants, all of our programs, to the concepts of diversity, equity, and inclusion. Interestingly, SAMHSA was the first federal agency in the country to require a diversity impact statement in any grant. And that is something that was actually established 9 years ago. One of the things is working with other federal agencies to have them follow suit. So we're actually very happy to actually help our other complement of brother and sister federal agencies to do that. In addition, be mindful of land acknowledgements. Be mindful of the importance that we recognize the land that we operate in, we live in, we sit in that our indigenous communities play a significant role as to who we are, where we are, and the fact that we are very much on sacred ground that includes all peoples, and to really understand the importance of that land acknowledgement. The other kind of overriding issues include financing and really thinking aggressively about different financing models, thinking very clearly about what is the engine that makes all of our programs and our healthcare system work. It's the people, it's the workforce, and really being mindful of not only SAMHSA's role in the workforce efforts, but in the fact that we can't do it alone. So HRSA, another federal agency, is the principal health workforce entity in the federal government, and we're doing a significant amount with them to actually build out a workforce agenda, which has been woefully missing in our federal landscape. And the final one is recovery, recognizing the importance of recovery for all individuals at all stages of their disease process, personal journey, but recognizing that we need supports to actually stand up someone's ongoing healthcare issues, having a safe place to live, having purpose in their life and being connected to their community, however they define their community. So that infrastructure is really guiding SAMHSA. And I think it's an exciting time, appreciating we are in a new phase of a new administration that's really very much in a bipartisan way, standing up the importances of behavioral health. Now, with that, how do we see that? Well, SAMHSA's budget has almost tripled since December of last year. Now, the majority of those funds have actually gone to the states. So as of right now, this region, $458 million are coming from SAMHSA to the 6 states of this region. That may feel like an awful lot. In Colorado alone, there's over $180 million from SAMHSA money standing up not only the state, but many of your programs, many of your local communities through discretionary grants. This is an unprecedented opportunity when it comes to funding and the flexibility of those funds to actually help shape and innovate our ways of thinking about doing business and reaching individuals in needs, all individuals. Money's not everything, and I would argue that's not enough. But it is a substantial opportunity for all of you to actually help OBH and help the rest of the state really guide innovative, progressive ways of reaching individuals, appreciating that some of our infrastructures are old, they're clumsy, government doesn't make it easy sometimes, but there's a real opportunity before us. And thank you for all of your leadership and all of that. If you haven't seen, SAMHSA recently published the 2020 version of the National Survey in Drug Use and Health. That is the national data set that comes out on prevalence and service utilization rates. It's the largest national study. If you did not see it, we're happy to kind of get that to you. I'm actually more than happy to do a presentation about it. However, we've not yet released the state-specific data. We anticipate that to be coming out soon, which will be very specific to Colorado, so that you have a sense of what Colorado looks like compared to other states in the region as well as the nation. Currently, what has only been published is the national data set, but again, still quite interesting and informative. Yes, we still continue to struggle with addiction. We continue to struggle with depression and anxiety across the board. Again, thinking about time, and I don't want to kind of delay your breaks. If you're not familiar with SAMHSA's enormous portfolio of free technical assistance and training programs that exist for anybody. You do not have to be a grantee. You do not have to be a state entity to receive any of the technical assistance and training, free webinars, free site-based consultation on various topics. Check out our website. In this region, specific to this region, which Colorado is a part of, there is a Center of Excellence for Substance Use Prevention at the University of Utah. There's a Center of Excellence for Addiction Treatment at the University of North Dakota, and a Center of Excellence of Serious Mental Illness with a specific focus on school-based mental health services, also at the University of North Dakota, but done in conjunction with the Western Interstate Commission on Higher Education in Boulder. Those 3 centers of excellence are free to you as a council, as a whole, as well as to any one of you individually. And I'm more than happy to send you a bunch of information, Bob, Ryan, Lloyd, whatever's going to be best to communicate to the rest of the group so you don't feel as though you have to take tons of notes. But all of these are free. In addition, given the conversation you had about diversity, equity, and inclusion, SAMHSA funds the National Network to Eliminate Disparities, otherwise known as the NED, N-N-E-D. They are based here in Denver, and they provide free training to agencies, to councils, to groups on issues related to diversity and equity. And that might be something for you all to think about, even as an invitee to hear a presentation from Raquel Espiritu, who is the director of the NED, who's based here in Denver. Finally, you're probably thinking, all right, who is this person? What is SAMHSA doing with the regional office? Well, 12 years ago, SAMHSA, actually take that back. Sorry, Lori. 10 years ago, SAMHSA established regional offices for the first time. It was SAMHSA's opportunity to actually get out of the Beltway and actually bring a presence for SAMHSA into the communities. I've been very privileged and honored to actually help build that infrastructure and be one of 5 remaining original regional administrators. So I've been in this position since SAMHSA opened it. I am based here in Denver. We have a small team, which includes Devin, who's with us, but also an assistant regional administrator whose name is Tracy Pohl. Some of you may have known Tracy. But quite honestly, our role and function is to be community-based, consultant, aid, ambassador, joiner, partner, someone to hang out with you individually, collectively, as well as your colleagues across the other 5 states of Region 8 to really stand up, think differently, and innovate with regard to how do we deliver care, how do we reach individuals where they're at and support them through their recovery. Our role is to represent the Assistant Secretary. Our role is to actually represent all of SAMHSA's programs, as well as other federal programs, in that we know, just like OBH, SAMHSA cannot be the only federal or governmental entity that's standing up and addressing behavioral health. It requires a full-fledged force of whatever resources, whether it's USDA, thinking about Mind Springs, there's great partnerships with the USDA and funding opportunities. The Department of Education, the Department of Labor, the EPA, the DEA, there are a number of different federal partners that have lanes and opportunities to actually help support and really grow a behavioral health program when we're able to kind of bring those partners to your questions and to you as a council. But our role is to do that and again, to represent SAMHSA the best that we can. So let me stop there. I'm happy to take just a couple minutes of questions. And then my apologies, Bob, I do have to jump off to another meeting in DC since I'm actually helping roll out the entire crisis system for the country.
Wow, that's incredible, Dr. Charlie. So you said the 988 National Lifeline.
Yes.
So when you call that, you said they're going to actually link the individual straight to services. Did I understand that correctly?
It's not quietly. I think part of it is the 988 number, which, by the way, is functional for most cell phone companies now, but the infrastructure in the sense of the individual state-specific nodes are not yet connected. So, for example, in Colorado, Bob, you know, we have the crisis, the Rocky Mountain Crisis Line. That crisis line will be directly tied into the 988 national line. So when you call, based on where your cell phone is and what your cell phone number is, you would go right into Rocky Mountain Crisis as an automatic. You'd be contacting them, even though you call 988. And then that process would be the same as Rocky Mountain Crisis, which would be identifying what the issue are, working with that individual based on what that issue is, whether it requires an on-the-site response, whether that requires potentially talking to someone who may be in crisis, and then clearly identifying then what resources may be needed for that person in crisis, just like 911.
Makes sense to me. What other questions do we have for Dr. Smith?
It's Margie. Charlie, yesterday the National Federation had its ED meeting, and we heard from Melinda Baldwin.
Yep.
That's from SAMHSA, and she talked about the best practice toolkit.
Yes.
That was being put together. And then also the work that is being done, recognizing the differences between what families and children need in that crisis process versus
right.
what adults need, and was seeking input and from obviously the different federations across the country. Do you see that this is one of the important tasks of this group is to maybe learn more about that toolkit and then also give recommendations to you, or is that being done in a different way? So
good question, Margie. And I was aware of your conversation at the national level with Melinda. So Melinda Baldwin leads for our Center for Mental Health Services. Oh, by the way, I just want to let you know, as a group, SAMHSA has established an Office of Crisis Services for SAMHSA, as well as an Office of Recovery, which I'm happy to kind of come back to council and talk with you more about. That's a teaser. Margie, back to your question. the toolkit, I believe, that Melinda was talking about was really helping to guide the national implementation of the 988 crisis system to make sure that it is equitably responsive and capable of meeting the needs of children and families. In that most crisis services are built around adults, single adults. And we know that we have to think of it differently when it comes to kids and or adolescents, young adults who may be in crisis where that adult system does not work effectively. Many of your organizations, your national hubs are interfacing with SAMHSA directly. Margie, it's a good question. I think it might be one worth kind of wrestling as a council. How can you help support and inform OBH and the state's leadership around crisis services in relationship to the national rollout? And obviously, I defer to Ryan and the other OBH staff about how best to do that, and that may be beyond today's time, but I think that there's great work that's happening in Colorado, truly a lead with the governor's support with regard to what that looks like. But I'm sensing, Marjorie, that this council may be quite valuable, have a valuable voice in that from a number of different perspectives. And then obviously use your leverage through your national parent companies or associations, if you will, to actually help inform SAMHSA. And you're welcome to share any of this with me, since I can serve as that bridge back to DC, since I'm heavily involved.
Great. Thank you so much for that, Charlie.
You're welcome. Yeah. Darren, I see you got a question.
Hi, Charlie. Thank you so much for coming and speaking with us. I'm a newcomer to this whole world. 7 years ago, I was digging out of dumpsters and due to my addiction, and now I'm put in charge of an organization. My question is: you spoke to the pre-technical assistance and training. There's a lot of in the Office of Recovery. What I would like to ask for is there's a lot of us that don't know how to create systems for gathering impact measurement. For creating customer CRMs and things like that. Is there any work being put into how do we create a recovery community? How do we a foundation to be able to serve the community with limited resources? Because really, it's only me right now.
Right. Great question. I think historically, SAMHSA has not had a lot of infrastructure at the national level to do that. In that, when we do, it's kind of working through existing national organizations, right? And the recovery organizations, while still in its infancy, are growing up. And but there is a community organization here in Colorado that's meeting, I think, every other month, speaking with RCOs to establish what you're describing. So PCA Embark, Rod Rushing, is leading that meeting on I think every other month, where RCOs are coming together to learn those various things about financing and infrastructure. How do I start? How do I become an LLC? How do I establish kind of my business model, develop community outreach and engagement, and so forth. And so there are a number of, I think, in the state, great people that you can lean on. Some of them may be here on council with you. In addition, the Center of Excellence here in this region, called the Mountain Plains Addiction Technology Transfer Center, has established a recovery working group. And I'm happy to give you a link to them. How deep they're getting into kind of new business models and getting that set up, I do not know, but they would have linkages to some of the larger statewide organizations that have done this that you may be able to lean on. So Advocates for Recovery, for example, I think I saw somebody representing them on today's call. It wasn't Tanya, it was somebody else. But you have some folks here in Colorado that you can definitely lean on. So
thank you.
And I see Angie giving a thumbs up. So feel free to kind of tickle the people on your council and circle back with me if I can be of help. Any other kind of quick questions? Lauren, yes.
If you
Laureen,
could,
my apologies. It's Laureen, correct?
Yes, thank you.
Yeah.
If you could, when you're talking with the government that controls the 988, that's working on the 988, some of us keep our old phone numbers So for
Yes.
example, I have a Tulsa, Oklahoma area code, and I don't want to be referred to Tulsa, Oklahoma. 'Cause,
Correct.
you know, they're not going to help me. So if there's a way to get around that, that would be good.
Yeah, Lorraine, you're hitting a hot button issue that actually Colorado is one of many states that brought that very much to the attention, which I believe 40% of the cell phones in Colorado do not have a Colorado area code. Yes. So it's that, and it's not unique to Colorado. My mother still has a Delaware telephone number. She's lived here for 10 years. This is a national issue, and there's a piece called geolocation that the FCC has to provide appropriate rule and direction for, and that's currently in process.
Okay.
In addition, I want to let you know, and again, my apologies since I do have to split off, there will be a text chat feature in addition to call, since we know that many individuals would rather text and chat rather than phone call. And so that will be another piece that right now is in front of the FCC and their leadership as of Monday to rule on, but we anticipate that to go through. But Lorraine, you're spot on. Yep.
Thanks.
Yep. So please feel free to kind of collect questions. Bob, I'm going to, I guess, probably let you kind of lead that charge and be happy to come back anytime and with whatever frequency, dive more into it, or just kind of join all of you and listen to your concerns and clearly help wherever we can.
Charlie, we have an interesting part of the agenda you can keep track of. It's now called What's Going On in Prevention, Treatment, and Recovery.
Sure.
So whenever you see that part of the agenda, you can totally call in. That's where anyone throughout Colorado and throughout this council can share exciting information, new information, and keep us all up to date on what's going on in people's individuals, companies, recovery organizations, treatment, new techniques. So it's something we're practicing, and we just started last month. So that's an informational section we have. So that being said, you can drop in too if there's something really cool happening and just say. So it's just an open forum for a period of time every month on the agenda to make sure we're staying up to date, and it doesn't necessarily have to be scheduled. We squeeze everything in.
Okay, awesome.
Well,
love
thank
to
you
and
for everything, and let us know how we can support you leading the crisis cause that you're organizing for the country.
Happy to. Listen, take care, guys. Wonderful being with you. And Marcella, always a pleasure. Glory, others, really miss you all and talk soon.
Happy Thanksgiving.
Likewise.
Ladies and gentlemen, it is now 10:45. I will see you all back from break in 10 minutes. Enjoy your break. 1 minute, so grab your cup of coffee, start coming back and turning on your screen. Finish up your smoke break if you are a partaker. All right, welcome back from break. Our next part is the second time we're really doing this, and it's what's going on in community. So we're going to talk about what's going on in prevention, treatment, and recovery. And this is an open forum. This is where people we schedule also come in and give presentations in this. I know Ty was not able to do a presentation today. We did have scheduled for you all today the fentanyl testing kiosk strips from Arts and Angie's group. That is going to be moved to next month. We're going to learn about fentanyl and the testing strips from Arts. They are leaders in a lot of this harm reduction and research and new techniques, since they're associated with CU, School of Medicine, Department of Psychiatry. They do a lot of research. It's a fantastic outfit. I used to work there, so proud ex-employee. It's now a round robin. I'm going to call out, we're going to start with prevention. So raise your hand, and anyone that's got information that's going on in our prevention community, your prevention organization, now is the opportunity to share information. So prevention folks, what's going on?
This is Bonnie. I can't remember if I made an announcement last time, but we actually have 4 new grantees throughout Colorado, and we basically did a targeted request for proposals to serve underserved populations. So our 4 new grantees are Voila for Health, which serves the Denver metro area, I believe. Envision You, which will be providing programming for LGBTQ youth and their families. Boys and Girls Club of Colorado, they'll be implementing services at multiple clubs throughout Colorado. And NASPACADE, sorry, the last one, they provide services to college-age youth on campuses throughout Colorado.
And what program was this that you were just speaking about? What are the 4 grantees again?
Sure. So this is through prevention funds through the Office of Behavioral Health, and it is through our Innovative Programming and Priority Populations Fund. And so these folks will all be doing either evidence-based or developing evidence programs targeting risk and protective factors.
Is there any other announcements coming from the prevention community?
This is Margie Grimsley, and just real quickly, the National Federation, in alignment with HRSA, got mini grants, and so we applied for a $3,000 mini grant, and we're partnering with the Jeffco Communities That Care, which is the prevention arm of the collaborative management for Jefferson County, and their intern youth from 3 different high schools are creating masks, and the purpose is really to help encourage people to be vaccinated for COVID. And these teens are creating, there'll be 6 different designs of masks that the youth are creating, and we will have them produced. And hopefully by next meeting, I could actually even show you some pictures of these masks. And it's a way for the teens to be promoting with other teens to wear their masks in the community. So it's kind of a neat project, and hopefully we will get all of these pieces put together by the end of November.
Any other community members with announcements on prevention?
I have one. I'm super excited. On next Wednesday morning, starting at 4:30 in the morning, we're going to have a homeless count out on the ground in Otero County. It's the first time in history that anyone has ever done that, and it'll help us get the data that we need to support some housing projects. So I'm thrilled.
So you're doing like what we do every year on the 20th. You're doing a pit count.
Yes, it's project specific, but we'll be focusing on Otero County, but we've never had a pit count in Southeast Colorado. So to do this in a rural area is so exciting, and we'll get some real numbers that we can work with.
We've only started ours in Aurora about 5 years ago, so don't feel so bad. As a major city with a shelter, we weren't really doing much. Well, congratulations on doing that work. It's something we do every year. So if you need some tips on how to do it and how to get engagement, you can talk to me offline. It's something we do every year, and it's a very important count. So
thanks, Bob.
Yeah, you're very welcome. Is there any other announcements on prevention activities? I have one that I will send out to you all. It's the Transgender Day of Remembrance. It's a free collaborating event to celebrate the lives of those that have been lost in 2021 to acts of violence. It's going to be, you can stream it live, and it will be at the Denver Botanic Gardens, Mitchell Hall, on November 20th from 1 to 3. And the doors open at 12:45, and my agency is sponsoring this with Connect for Health Colorado, Colorado One, and we'll have some other organizations that'll be supporting us for Transgender Day of Remembrance, November 20th. And I'll get that out to you all, and you can stream it live, and you can certainly get that into your organizations, family members, and recovery communities, so we can respect those that have lost their lives due to domestic and community violence. Next up is what's going on in our treatment community. Treatment folks, what's going on?
So Bob, I have a question for you. Last time we talked, you asked if I would do a little presentation on levels of care. Do you want me to do that today or another time?
That would be awesome if you can do that today. That's part of this section. So please, we talked about what is level of care, what changed, why do we have a level of care in Colorado, and what does it mean?
Right, okay. So is there a way for me to share my screen? Can you allow me to do that?
I just made you a co-host, Crystal. You should be able to now.
Okay. Sorry, give me 1 second. So before I do that, some of you have your camera off, but I was just curious, by a show of hands or a little emoji if you're off camera, how many in this council meeting this morning are familiar with the ASAM, American Society of Addiction Medicine, levels of care, and the 6 dimensions?
I am, Crystal. We are at IDEA.
Okay, I'm guessing that half of us, maybe not, right? If family members and whatnot. So I will try to keep this concise. And Bob, how long do I have? Like 5 minutes? Maybe less?
7.
7, okay. All right. Okay, can everyone see that? All right, so this was a presentation on ASAM that was given to us by the ATTC, which Charlie talked about. So it's supported and funded by SAMHSA. It's 46 pages, so I'm only going to show you a handful. This first definition of medical necessity has been very interesting when it comes to Medicaid starting to cover residential SUD treatment as of January 1st. It's getting a little bit better, but I just wanted to show you this definition because at the beginning, it really seemed like the Rays were denying for not meeting medical necessity criteria based on primarily Dimension 1 and Dimension 2 out of the 6, which I'll get into those. But really for ASAM, this is biopsychosocial severity in the 6 dimensions. So it should not be restricted to acute care and narrow medical concerns, such as severity of withdrawal risk or acuity of physical health need or psychiatric issues. There are 6 dimensions, not just 3. So oftentimes they were denying based on information in dimensions 1 and 2 primarily. And again, I'll go over those. So, for example, we had a client who had about 45 days of sobriety when we did the prior authorization request. And they denied the request outright and said, well, they have 45 days of sobriety. So we did a peer-to-peer review, and basically we're told, you know, he can be in outpatient, doesn't need residential. And it's like, okay, so prior to coming to our TRT, transitional residential, he spent 30 of those days in a hospital, right? So that really doesn't count for sobriety in terms of time on his own. He also does not have a job, does not have a place to live, has psychiatric concerns, right? All of these things that would make it just impossible to put him in outpatient from our perspective. And so we do not send clients out of our program if they get denied. If we believe that they still meet criteria for residential, we keep them. Just kind of a side note. So I wanted to share that with you. And then, okay, so this next page, just to go over the levels and the continuum of care within the ASAM. So 0.5 is early intervention. Level 1 is what we would call traditional outpatient. In our program, that's typically once a week for group for 2 hours and maybe some individual counseling, depending. Level 2.1 is intensive outpatient. So that's 9 hours per week, 3 hours, 3 times a week. Level 2.5, partial hospitalization. I'm not 100% sure how many of those levels we have in the state. Our facility does not offer that. Level 3.1, clinically managed low intensity residential. So we call this our transitional residential treatment. Sobriety House has this. Level 3.3, clinically managed population specific high intensity residential treatment. I believe some of the therapeutic communities might fall under this. And then 3.5, clinically managed high intensity residential services. This is what we call just IRT, intensive residential treatment. Typically the programs run about 28 days, but it really depends on the client and if they continue to meet criteria. Okay, and then they have the adolescent 3.5. Level 3.7 is medically monitored, intensive residential or inpatient. We had a license for this, but we're not going to keep it active because they want 24/7 nursing staff, etc. It's really hard to get credentialed with the raise for 3.7. And then here's the adolescent. Level 4 is medically managed intensive inpatient. So this is hospital level. And then opioid treatment services, OTS, is a level of care that's offered. And then we have the withdrawal management. I'm personally only familiar with the social detox, right? So all of these levels of care, I'm not sure what criteria you need to meet for these, but these are all of the withdrawal management, medical or social, right, for detox. Okay, let's see, page are we on? All right, so I'm going to skip here. Any questions on that so far?
So what you're presenting to is, for those that aren't used to seeing what they're seeing, is there's a battery of assessments that take place. And then when you take a look at those assessments and you start utilizing this tool as well, is where you start the evaluation process of where someone's clinical, behavioral, social, emotional need is in order to provide that level of care. And then this level of care opens up different levels of funding streams as well. But there's a lot of different issues we are currently still experiencing in Colorado with the raise and getting access for community members needing treatment and getting through the process, which is something we can take up another day. But I wanted to make sure that you all had an opportunity, you know, to see how people access and what they go through in order to, and there's a battery of tests that we have to do by licensure to get folks in there. But I just wanted to ad-lib a little bit into there, but go ahead, I'm sorry.
No, thank you, Bob. I appreciate just adding some color and context, right? And so for those who aren't familiar with what a RAE is, that is a regional accountable entity. They essentially take the Medicaid funding and distribute it to the providers depending on the region. So it gets really complicated. There are 4 RAEs within the state of Colorado. There are 7 regions, and they're all kind of mixed up. So happy to go into that another time. And so I'm going to talk a little bit about what Bob said around how to determine level of care. So the primary, we use several assessment tools, but the primary one is the ASAM criteria. So each of those levels of care that I just went over has criteria within the 6 dimensions of ASAM, which I'm going to talk about, that you have to meet and prove essentially to the RAE if they're going to provide funding for that. So with each of the 6 dimensions, we rate them on basically this Likert scale on a 4-point from 0 to 4, 0 being very low risk or no risk to 4 being very severe. Okay, so I'm going to skip a couple pages here. Okay, so dimension 1 is specifically acute intoxication or withdrawal potential. So these are the questions that we're looking for. What's the risk associated with their current level of acute intoxication? Is there a risk of severe withdrawal symptoms? So we're looking for, especially with alcohol and benzodiazepine withdrawal, those are very life-threatening. So seizures, DTs, is there a history of that? How much sober time do they have when we're evaluating them, and are they at risk? Vital signs. So, you know, we don't do vital signs for residential treatment, but that would be in detox, right? So we're determining the risk level within dimension 1. Dimension 2 is basically medical conditions or complications. So before they come into our residential program, because we don't have medical staff at Sobriety House, we want to rule out any primary medical concerns that would need to be addressed, something serious, right? And we do like an imminent danger kind of assessment where, you know, if they need to go to the hospital, we're going to send them right away. But we talk about all kinds of things, right? So if they have an HIV diagnosis, pancreatitis, anything medical, whether it's chronic or acute, that's going on with them. Pregnancy would fall under here. So we're just asking these kinds of questions for dimension 2. Dimension 3 is emotional, behavioral, or cognitive. So this is basically the psychiatric mental health. And so for us specifically, we're going based on the client's report to us if they've had diagnoses, but they might have a lot of symptoms and have not had a mental health evaluation yet. And so that's something that we can set up and establish if necessary once they come in to us, but we're determining how severe this is. And these are the questions that we ask. Okay. A few more questions for dimension 3. And we're trying to determine, right, like some of these symptoms might be caused by their substance use, and some of it might be like the true clinical anxiety or depression, etc. Okay, and then we're looking for risk in dimension 3 for mental health. And we're doing screenings for suicidality or ideation, etc. Dimension 4, readiness to change. And so these last 3 dimensions, like I mentioned, doctors and medical staff at the RAEs, the ratings here could be very severe. right? And you don't have to have really high ratings in the first 3 dimensions to qualify for residential treatment, quite frankly. So we're trying to really shift that perspective and have the rays understand what all of this means. But so readiness to change is, how aware are they of the relationship between their, drinking or using involved in their negative life consequences. Some have a lot of awareness around that, some don't. How ready and willing are they for treatment? And how much are they involved or feel control in their treatment services? So we at Sobriety House get a lot of involuntary commitment clients, and oftentimes at first they're angry about that, but ultimately they, for the most part, end up being pretty willing to come to treatment. And there's a whole spectrum of willingness, right? Okay, dimension 5, this is the potential for continued use or relapse. And so are they in immediate danger? If they don't come to treatment, in other words, what is the risk of them returning to whatever environment they came from that they're going to end up still using? And for the clients that come to us, this dimension, like typically 4, 5, and 6 are rated quite high. Okay, what are their coping skills? Are they able to stay sober without being in a certain level of care, right? Okay, a few more questions on dimension 5. Has to do with awareness too, and just their coping skills. How severe is their distress? Okay, dimension 6, this is the last one, and it has to do with the recovery living environment. So a lot of our clients are either homeless or they live in a situation where other family members are using and it is not safe or supportive. So we're rating here for social environment, supportive relationships, including, vocational, do they have employment resources, things that are going to help in the biopsychosocial sense in the big picture of recovery. Okay, I think there's one more page here. We would also include any legal, maybe they have a social services case for their children. Maybe they're on probation for something that had to do with their use, things of that nature. They might have transportation issues. All of those things are being addressed in dimension 6. So that's pretty much all I had as far as showing you the slides. I can stop sharing my screen here in a second, but curious if there's questions. Bob, you're welcome to chime in some more, or any of the other treatment folks.
So I wanted to, I am going to move us along, but I wanted you guys all to have a taste of some of the changes here in Colorado that are good, bad, and indifferent. We're definitely experiencing some problems when it comes to some of the new assessments and the way we are screening individuals, which I do believe impacts the work that we do here through equity, equality, and inclusion. These are all assessments on how someone comes into a treatment center, and this is how you're evaluated. This is how your recovery skills are evaluated, your potential for relapse, and everything else that we do through assessment. So it's a very interesting thing. So I wanted you guys to have a taste of that today. The word RAE, R-A-E, Regional Accountability Entity.
Yep.
Yes. That is a managed care organization, since we're a managed care state. So the state gets money and then it puts it out into the community through these RAEs. And in Denver, your RAE would be Colorado Access. So they also have a whole plethora of issues as to people accessing recovery supports, as well as accessing treatment. We're working through a lot of those barriers, but we'll talk more about that as a council as we dive deeper into the equity and equality work, and we can start pushing back on some of the systems where it's hard for people to access their benefits and quality of care. So that's some of the work that we're going to be doing today. But thank you so much. Sobriety House is a great organization. Check them out. I did notice there's a lot of questions I read through in the text box. These are all hot topics that I do want to address and spend more time on, but we're not going to be able to get to that today. I do apologize, but I did want to give you guys a teaser on some of the work that we're doing and some of the issues that we're having in treatment. But I would love now to move us on to recovery and our fantastic recovery partners. What's going on in our recovery community?
Hi, just a couple things. First of all, we have a new executive director at CAR. So if anybody needs me to do an email introduction, I'm more than happy to do that. We have funded the two Latinx programs. I don't know. Bonnie said, I don't know if I said this last week. I don't really either. So we did Young People in Recovery and Servicios are going to be doing the peer services for the Latinx communities. They're actually both in Denver. Let's see, we have the PATH. The PATH RFP is in downtown. I will put this group on the push list for that. So be on the lookout for that. I know that there's lots of mental health centers and treatment centers here that could possibly do PATH and do that RFP. So let's see. I think that's it. I think that's all I got.
Would you mind, so for Latinx, and we're working on inclusion and diversity, could you please work with us on getting those two organizations' presentations on how they go about culturally providing those peer-based services, Servicios de la Raza, as well as Young People in Recovery, the RFPs you gave them? I'd love to learn more, and I don't know enough myself about resources, and I'm sure the rest of us don't. And these are actually two amazing organizations that I would love to hear from here on our council. Is that possible that you could reach out to them?
I can definitely reach out. They just got into contract, so we're busy like getting what they're doing and stuff like that in their SOWs. So it's not going to be in the next couple months that we'll be able to be doing that, but I will definitely. I actually have an appointment with one of them today, so yeah.
Well, let them know we're very interested to hear this specific work. And our agendas I'm keeping pretty packed, so I'm sure we'll get them on in the near future. But thank you. Do you mind explaining PATH? Because I don't know if this group even understands the acronym or what you just talked about.
PATH is a program that OBH gets through from SAMHSA. It's projects for assistance in transition from homelessness. It is a case management program for the homeless. So connecting people that are homeless to physical providers, mental health providers. PATH doesn't necessarily pay for housing, but usually housing programs have vouchers and work with DOLA and stuff like that. So, yeah, that's what it is.
When does that RFP come out?
I don't know. It's downtown. We got it finished at OBH, and then it goes downtown, and then it is what it is from there.
Great. When if you could send out the RFP to us, that would be great when it ever gets released.
Yes.
So that way,
this group is going to be on the list. Yes.
Perfect. Thank you so much. Great updates. What else is going on in our recovery community members?
I think Brian's unmuted. I hear him.
Thank you, Leah.
Do you have a question?
Yeah, totally. Thank you very much, Leah, for all the work that I know you're putting in with CAR. And I just wanted to remind Bob and the rest of the council that we did table last month a hopeful request to have them come and speak to us some point soon. So just wanted to readdress that. And then also definitely throw my hat in the ring for an introduction to this new executive director. Aaliyah, if you can make a note of that, I would highly appreciate it.
I'm going to do it right now, Brian. Absolutely.
Thank you.
Absolutely.
We'll all take an introduction, put it that way.
Well, to the executive director?
Sure.
I don't think I can do can I even do with the council, Donda? Can I even do an email to everybody introducing them to Butch?
You want to send it to me? I can send it out to everybody. Not a problem.
Okay, sounds good. What else was it? I was going to say something to that effect, but yeah. Okay, great.
Aaliyah, I think for me, it's more just I need to know what the next steps are for my organization to be certified. That's what I'm after.
Yeah, and I mentioned this, and he actually said that he would like to talk to you.
Awesome.
So, yeah.
Thank you so much.
Absolutely.
We used another acronym, and I want to be sensitive. Does everyone understand the word CAR and what it is implying and what we're talking about? I just want to make sure everyone has equal footing on these acronyms. So if someone has a question and would like to learn a little bit more about CAR right now, please let us know and we can briefly describe CAR and credentialing.
That would be great. I put that question in the chat actually directly to Aaliyah, so I don't know what it means.
Thank you. Aaliyah?
Great. Thanks, Bob. We, acronyms. I usually go through meetings not knowing anything. So CAR is the certifying body for recovery residences here in Colorado. It stands for Colorado Association for Recovery Residences. Legislation went through about a year and a half, 2 years ago that recovery houses had to be certified by a certifying body provided by OBH. That's not the right word. Ryan, what's the right word there?
OBH is the entity that approves the certifying body.
Thank you.
So it's not us doing the certifying, it's us approving who does the certifying.
Yeah, thank you. And legislation has just come out with the 137s, the Senate Bill 137, who, if I don't know as much about it, but it was Pedersen's bill that put a lot of money into recovery. We're actually funding this entity. And so I was talking last month about how that RFP is going through, and that's happening. It hasn't happened yet. We're scoring it this week. So
at some point when the dust settles, it will be nice to hear from what the process is from the executive director of CAR. And we will learn more once the dust settles. Is there any other updates coming out of our recovery community?
Yeah, Bob, I have a quick one. This is James with Advocates for Recovery Colorado. I just wanted to let everybody know that yesterday we had an amazing opportunity to be featured on the Kyle Clark 9 News, the Next program, which is a giving program for local nonprofits. It was really based around our Swedish emergency department program. But we did get featured on it, and I'll put the Zoom link in there or the YouTube link in there if anybody would like to share it, as it's really helped us to continue funding the ED program that we started. And so I just wanted to let everybody know that Kyle Clark said that he wants to focus more on the recovery in Colorado in the upcoming months. So
congratulations. It's always nice to be spotlighted when we're doing good work.
Yes.
Paparazzi, you even got some paparazzi on the TV screen there. Good work, advocates. What else is going on in our recovery community?
Yeah, hey Bob, this is Jacob. So at some point in time, I'd like to invite the new executive director from COPA, which stands for Colorado Providers Association. They are the Colorado trade association that works across the behavioral health spectrum of care. with treatment, with recovery, all services. It's a trade
Prevention,
association.
intervention.
Exactly. So the new executive director, Bria, I'd like to invite her in at some time and also do a presentation for both the prevention certification in Colorado and the peer certification in Colorado, what that process entails, how that develops our workforce across the state, and also kind of what's going on the behavioral health task force and kind of where peers are going in those realms. So I'll be getting with you at some point to invite Bria in, and we'd like to do a presentation.
Absolutely. I think everyone will really like to know about our trade association, which has a lobbyist attached to it. So when you pay dues to your trade association, our lobbyist is Front Range, and Jennifer Miles, who's fantastic, then goes down to the Capitol and speaks on our behalf as providers, and sometimes gets in OBH's face and letting them know what us in the community and community providers need. So that's called the sausage making you guys keep on hearing on the news. But we do have a lobbyist and a trade association that does advocate for us and works directly with OBH on our behalf. So yes, let's make that happen, Jacob. What else do we have out there, recovery friends?
I'd like to share that the PAL-2 study has started, and PAL stands for Peer Alternatives for Addiction. Back in 2015, this study was it's sponsored by the National Institutes of Health. A PhD doctor, Sarah Zemore from Stanford Medical Center, has basically run it. It basically looks at the benefits of mutual health groups in recovery. And so it focused last time and again on alternatives to 12-step models. So Smart Recovery, Women for Sobriety, and LifeRing Secular Recovery are all being included in this new study. So results of it will probably come out in late 2022. And I just wanted to mention that because there are other alternatives.
Thank you. Do we have anyone else from our recovery community that would like to address us? On that note, I'm going to work towards getting us back on track now. Thank you everyone for the updates. I really appreciate this part of the agenda. I see everyone wakes up and there's always a lot going on. So, the callbacks, if we could add to the list that I've heard, is we'd like to meet the executive director. We'd like Arts to present next month as to the kiosk and those strips. We also would like a callback on Ty had a presentation for us that was not able to make today. And I think I'm missing something that was a callback from a member. Brian, was it you that you had a callback on that you wanted more information on?
No, I got all the clarity I needed from Aaliyah for sure.
Okay. If I'm missing anything and something called back, let me know and I'll get it added to the agenda. Or just email. All right, next up on the agenda is OBH BHA update.
Thanks, Bob. And first, we usually start the OBH updates with the updates from our members that represent BPAC on different committees. I know Ty's not here, who represents BPAC on the mental health disorders in the criminal and juvenile justice system task force. I can provide a little bit of update on that. Not necessarily his position or the task force, but the legislative oversight committee that task force informs. They had some bills drafted. 5 bills from them are moving forward. I'll just put a link to the page if you're interested in looking at those bills. There's the bills as well as fiscal note. They had 8 bills drafted. They only have the ability to pursue 5 of those bills. So it is Bill 2, 4, 5, 6, and 10 are the bills moving forward, but I'll just put this in to the chat if you're interested in what those bills are. It's continuing that legislative committee. There's a bill that makes modifications to the not guilty by reason of insanity statutes. There's a pretrial diversion for persons with behavioral health disorders bill. There's updates to the 2765 emergency procedure, allowing not just the imminent danger criteria, but also including imminent or substantial to put someone on a mental health hold. And then there's the last bill that they're moving forward with is programs to develop housing support services. So those are the 5 bills coming out. So we'll be talking about a lot of those bills over these next couple months as the legislative session gets moving here. Questions about those? Kind of a lot of information right there. But we can probably in December, at the very latest, January, we'll kind of start back up with some legislative updates. So Lorraine State Rehabilitation Council, any updates from there?
Just that I received 2 things. I received confirmation last Friday that the state finally approved my application from way back in the spring to be on their commission or their group, the State Recovery Committee. And then I also got a notice from Augusta Klimek that they have chosen a new manager for the SRC, Megan Gallegos, who's going to be starting in a couple weeks. That just came in on November 1st. And then I got something from Mark Kolash, who's their legal advisor, just sending the list of committees to choose from. So they're going to be meeting later in November or December. I'm not sure which. Nothing really more than that to report.
Thank you. So with new members, the Office of Behavioral Health has a monthly news and updates newsletter that comes out. If folks are interested, I can put the information in the chat about how to sign up for that monthly newsletter. It contains a lot of information about funding opportunities, training opportunities, just general news. It comes out the 4th Thursday of every month. So there's one that just came out last week. So with that, kind of the headline in that one was that the iMatters program launched. That's those 3 sessions for youth. I can put the link to that website. So that's where those 3 free behavioral health sessions, paid for sessions. You can go to the website that I put on that link, both youth as well as their parents can fill out an initial survey and then schedule some confidential or fill out the confidential survey and then schedule appointments to meet with licensed mental health professionals and have at least 3 sessions paid for. So a bill from last year. This is really that we're finally here implementing this, and thank you to Signal for being our partner in getting that program out the door. Questions about that program it's called iMatters?
I'm going to have iMatters present.
Okay.
Ryan, when you're talking about the newsletters, there is something that is taking place in a state that is absolutely massive, which is the Child Welfare Reform Families First Act. And there's a great monthly newsletter on families and the Families First initiative here in Colorado. If that can be sent out to this group distribution list, I highly encourage everyone to sign up to understand that the state of Colorado is in the process of transforming its child welfare delivery system. Everything about the system is changing, and it's massive legislation. It's a massive change. It's pretty incredible work that's being done, and there is a lot of information that comes out from the state. So that would be another great way for you to stay informed as to some massive changes in the state. And I'm also a voting seated commissioner on Families First.
Yep, and so just to follow up, thanks, Bob. To follow up on that, I have a meeting with the director of the Office of Children, Youth, and Families, as well as the director of the Division of Child Welfare. They have a specific seat on council, so I'm talking with them later this month about who's the most appropriate, and I will bring that up specifically about Families First and ensuring that there's always that representative voice and any updates related to Families First. There's legislation that's passed the last couple of years related to Families First as well, so I'm making sure that it's at least we're as well informed as possible from our sister office within CDHS about the pretty massive overhaul, like you said, within the child welfare system there.
Massive is the key word, and I think BPAC should know. I don't want to carry the water. Let the department do that for me as a commissioner on that.
I'm just going to link the newsletter in chat.
But it's fantastic information, colleagues, on what's going on for Colorado's families and child welfare delivery. And it's pretty exciting stuff.
A few more updates just based off of the newsletter. Our controlled substance licensing and opioid treatment program rule update is going to State Board tomorrow for first reading. This is based on some feedback we received some stakeholders about some requirements that we put into place earlier this year. We're really rolling back some of those things. It was specific around the 40% medical director requirement in opioid treatment programs. We're rolling that back and really aligning our OTP, opioid treatment program rules with the federal requirements. The federal government has a ton of oversight of opioid treatment programs. So really we're just trying to align our rules better with federal regulations as well to really try to decrease some of that provider burden, because there are so many entities that have some level of oversight into those facilities. So if you're interested in that, it's at State Board tomorrow. We're 11th or the 11th rulemaking packet on the agenda.
So Ryan, you're talking about our methadone clinics?
Correct, yes.
Okay, so all right. So, and what's happening to the methadone clinics? Exactly, that's before the state, I guess. What are we trying to align and do? I guess I'm confused.
So the Office of Behavioral Health licenses those facilities.
Correct.
So with that, we have rules in place for what that licensing structure is and the standards that those programs must meet in order to obtain and maintain a license in Colorado. So those rules are going to State Board to better align those rules with the federal requirements and address some stakeholder concerns that were brought to our attention earlier this year. I think we haven't really received any major feedback because we did this rule update pretty closely with the stakeholders that address the concern, as well as with our federal partners. So with that, I mean, if you're interested, there's an opportunity to testify.
There won't be an impact to consumers or disruption for consumers that BPAC needs to be aware of or advocate for. So Angie, is there anything you need from us to support you on with any of this?
I think Angela Bonaguidi, the director of our outpatient clinics, which they house our 3 OTPs. She's pretty on top of it, but I will let you know if we need anything.
Yeah, we're happy to support when it comes to consumers, so let us know.
Yep, the hope is that these rules, by decreasing some of the provider burden, allows for more access to medication assisted treatment, which I think overall is a very good thing for the people of Colorado. One of the pieces in that rule was rolling back the client provider ratio to allow for OTPs to serve more individuals. We know that there are waiting lists at some OTPs, which has a very detrimental effect on people accessing services if they can't wait for them. So yeah, that's really our main focus in us setting these regulatory standards, as well as making sure access and safe service delivery. Another rule update, a bill earlier this year, House Bill 1305, made some changes to how individuals pursue licensure as an addiction counselor. That bill required the state, the Office of Behavioral Health specifically, to establish training standards for individuals pursuing licensure as an addiction counselor. Prior to House Bill 1305, Office of Behavioral Health set training standards for the previous CAP 1, 2, and 3, which was a couple of years ago, changed the technician and specialists. We set the training requirements for those individuals seeking that credential. This bill also has us setting the training requirements for the licensure. So those rules are currently out for public comment. It's essentially saying that thou shall meet certain number of training classes in order to and include those confirmation that you completed those training requirements when you go back to the Department of Regulatory Agencies to apply for your licensure or credential. So OBH plays a relatively minor role within the credentialing of addiction counselors, and it's still DORA and their Addiction Counselor Examiners Board that play the heavier role in that, the actual licensing and certification of addiction counselors. So look for that if you're interested in that, interested in what that looks like. I can also put the link for where you can see the rules, as well as fill out the form if you're interested in providing us some feedback about what those rules look like. Another big thing that came out earlier this week was the governor's proposed budget for fiscal year 22-23. I'll also put a link to that in here. I think it's like 90 some pages of a lot of dollar signs. But with that, there are some OBH specific things in there, including $3 million for the Behavioral Health Administration and getting that up and going, as well as you'll notice in there that there's about 10.3 or 10.4 million dollars to open 2 units at Fort Logan. I just wanted to be clear that those 2 units are specific to forensic services, so that competency evaluation and restoration. I think we get a lot of questions about, well, what about civil beds and access to civil beds, right? And Fort Logan is often seen as that state hospital that houses the civil beds. This is opening 2 units up at Fort Logan for forensics. So just to be abundantly clear, this is forensics units at Fort Logan, and that have been renovated, but now it's ensuring that we have the money to actually operate those 2 units at Fort Logan. Currently, there's about a 350 person wait list to get into competency services in an inpatient setting. So that's part of trying to get those numbers down so people have access to the those forensics, those court requirements to get competency evaluations and restoration services in the inpatient setting when a court assigns them to the state hospital. Questions about that? I mean, that's a very quick overview of just 2 fairly 2 pieces within that budget. This is really that first start of the legislative session once the governor's budget comes out. So,
Ryan, can you repeat again what the waiting list is for those forensic competency?
Last I heard, it's 350 approximately. And I think the last I heard was that the waiting list for the civil beds at Fort Logan is about 40. So there's a long list to get into those state operated beds.
Thanks.
And how many forensic beds will this new money create?
44.
Great, thank you.
Yep. Yeah, so then before we get into the Behavioral Health Administration, I just wanted to touch base about the Behavioral Health Transformational Task Force. That's that task force that's also part of Senate Bill 137, created this legislative task force to come up with ways to best spend or plans to spend roughly $450 million of federal COVID relief funds. That task force has been meeting consistently. There's subcommittees of that task force, and my understanding now is that they're starting to formalize some recommendations. So I'm guessing by the December BPAC meeting, we'll probably have at least some form of recommendations coming out of the task force, which will either lead to which will more than likely lead to some sort of legislation in the 22 session to come up with ways for spending that $450 million that is specifically set aside for behavioral health services in Colorado. So be on the lookout for that. I don't know if any of you all participate in that task force or those task force subcommittees and have anything to add to that.
Ryan, I don't know if those task force and subcommittees have been really inclusive, to be honest with you. I don't really know anyone sitting on those. I don't know anyone in Aurora. I mean, I don't know if Aurora Mental Health is. I don't believe they are, but I don't think that process has been really very inclusive.
Yeah, I mean, I can see where you're coming from with that for sure. Yeah, and I'll gonna give that information to.
I mean, it's crickets here, if that gives you any indication. And my colleagues, I've not had any emails or communication on how to advise on $450 million. But I've got ideas.
Yep, and then to tie everything together, the plan for the creation of the Behavioral Health Administration came out earlier this week. So I'll also put that in the chat here. So this is 109 pages of a document that really sets the foundation for what we believe that the Behavioral Health Administration should and could do to support the people of Colorado. So this is after the years of work and the legislation from earlier this year that set the foundation for a new behavioral health administration that really establishes some stronger accountability for the system, as well as ensuring that there is a voice. Everyone has a voice in what the system looks like. And I think that's a big piece to coming back here, and advisory councils similar to this is ensuring that people have a say in what behavioral health services across Colorado looks like, as well as having a structure of behavioral health services that there is accountability there, that there is a way to influence that system. And even just reading through the chats during Crystal's presentation on ASAM is how do we better align state departments to ensure that, I mean, assessments are consistent across state departments and they're the same requirements for, because it's very difficult on providers to go through a process and feel like this is what is needed to meet the needs of an individual, only to have it say, no, thanks, we're not paying for that. I think is very, very disheartening, both to providers as well as individuals actually in need of that level of care. So I think this is exactly what the BHA is supposed to, or the Behavioral Health Administration is really supposed to address. So be on the lookout for a pretty large bill during the 22 session that really establishes those core duties. There are some legislative pieces within this 109-page document that I shared about kind of the foundational duties and what those pieces are. And I would also encourage us to have that discussion about I know December meetings is filling up fast, but this I think would be a really good time to have summer gather call, come back to BPAC and talk about the Behavioral Health Administration and this plan and kind of what those next steps are, and how groups such as ourselves can really be more involved in that process moving forward on this front end of creating this pretty large overhaul.
Is the BHA getting a new building?
No, so the meantime, it's going to be housed within CDHS. There's going to be a commissioner that reports directly to the governor. So it's not They're
not moving out anywhere.
Not for now. They have to make a plan to where it should be housed in the next few years, but in the next 2 years, it will be within CDHS.
All right. Yeah, I just can't. Yeah. Okay. The housing issue of it, where you guys all can be together, communication is key when you're doing these change management things. So I'm glad to hear that they're going to get everyone together. Yeah, it would be great to have Summer come back.
Yep. So I think we got some work to do in steering committee coming up with getting the agenda right for next month. But with that, I'll definitely request her presence. And then the last piece that I wanted to touch on is that from last time, we also talked about Mental Health Colorado really leading the charge on a 2765. So that proposal, that's the care and treatment of persons with mental health disorders. That's that voluntary and involuntary process for individuals with a mental health disorder needing care and treatment. Mental Health Colorado is leading this rather large charge to update a big pieces to 2765. It was requested that Mental Health Colorado come. I think we're probably 1 or 2 months a little too early because there's a lot of pretty large pieces within their proposal that still need to get hammered out. I have a meeting in 3 minutes with a subcommittee of that group to talk specifically about certifications, but I will also talk with you all about what that looks like in the next month or two, because that is a pretty massive overhaul from statute that we're working off that's roughly 45 years old, that a lot of individuals and a lot of entities that are very hesitant to open up and make changes to, because it is complex and it's about patient rights and it's about essentially taking someone's rights away in order to essentially force them into treatment. So it brings up a lot of experiences, both good and bad. So there's just a lot of pieces moving in there that we, talking about an EDI lens, making sure that that's a major focus within those conversations as well. Questions about that?
I do, right. And how was it that Mental Health Colorado was determined to be the organization to lead that effort as opposed to the office itself?
Yeah, so we worked in collaboration with them on two things. We had a part that we thought that there needs to be changes to how intervening professionals, those individuals that place someone on hold, and the new transportation hold. Those were two pieces that we thought needed to get updated, two relatively minor pieces, not opening up the whole thing. We were also informed that Mental Health Colorado planned to completely overhaul some of that, some additional stuff related to the 72-hour hold, as well as the certification process. So that, just being an advocacy organization that they are, they were planning on running legislation no matter what. So, but I can definitely pursue having Mental Health Colorado come to Bhpac as well and talk specifically about their plans, because it is pretty comprehensive and intricate with what they're thinking. That and just to be clear, that the state is not in a position to support or oppose any of the what Mental Health Colorado is pursuing at this time either. So it kind of puts us in an interesting position with an organization like Mental Health Colorado pursuing pretty massive legislative change like that.
Mm-hmm.
Questions? I know we're kind of pushing right at noon here. Not hearing anything. Kick it back to you, Bob.
Well, we made it to noon. Ryan, thank you for your update. Congratulations to all of our new members today and welcome aboard. You got to hear a little bit about our strategic framework as to moving forward this year when it comes to equity, inclusion, and diversity, as well as kind of resetting our bylaws and how we're looking at the work that we do. So we've got packed agendas, we've got lots of presentations, and lots of information coming at you guys. So always just let us know if you need any support. We're all here to support one another. So have a great Thanksgiving, and take care, and I'll see you in December. Happy holidays. Happy Thanksgiving.